Federal Medicaid cuts from Trump's big beautiful bill are expected to strip healthcare from 86,000 Iowans over the next 10 years. One rural hospital administrator warns that the financial impact could be felt in months. When Dr. Robin Plattenberger retired from her Washington County practice 8 years ago, she left behind patients who depended on Medicaid for everything from nursing home care to emergency visits. Now, as federal budget cuts threaten to strip Medicaid coverage from those 86,000 Iowans, she's watching her former employer, Washington County Hospital and Clinic, prepare for what could be devastating changes. She says there's really no extra money in a hospital. She recalls her clinic operating on just a 3% margin, and now you have to cut back what you had, and you really end up with no choice but to cut service. The cuts come as Iowa already faces a healthcare crisis. The state leads the nation in growing cancer rates, while rural hospitals struggle with thin margins and staffing shortages. Hospital CEO Todd Patterson pleaded with Iowa's lawmakers to avoid making cuts into this lifeline. He wrote last May that the cuts to Medicaid don't just affect our ability to offer new programs or upgrade equipment, they force decisions about whether we can keep our maternity ward open, retain emergency services, or offer mental health care. Patterson warned that the timeline is shorter than many realize. Rather than taking effect years from now, he says hospitals will start feeling the financial squeeze within 4 to 5 months as they plan for reduced Medicaid reimbursements under the legislation. 2 Iowa hospitals in Newton and Manning appeared on a list of rural providers considered at risk. Side note, the Tax Policy Center estimates that the one big beautiful bill will raise the national debt by $4.2 trillion by 2034. That's 9% of the GDP. Everyone deserves healthcare. Read more over Iowa's starting line. Thanks for watching.